thank you, everyone, and welcome. We appreciate having you here. We're excited to have the conversation that we are going to have here in a few minutes. My name is Katie Grimm. I am the VP of Sales at S2N, but more importantly, just here to kick off the conversation between Amy Siegel, CEO of S2N Health, and Dave Roberts, retired president from Medtronic. Quick housekeeping items before I turn it over to these two. We will save some time at the end for questions. So if you have any, there is a Q&A box that you are welcome to drop those into, and I will be trying to help moderate that throughout the presentation. And additionally, we will be recording today's presentation. So if everyone is aware of that, we'll make sure to distribute it after, should there be anyone you wanted to share it with who was unable to join today. So with that, I will go off camera and I will pass it over to Amy and Dave. Amy?
Hi, everyone. Thanks for joining. And thanks so much, Dave, for joining. It's been great to work with you so far. I'll introduce myself real quick. Amy Siegel, I'm one of the co-founders and the CEO of S2N Health. We're all about helping medical technology companies have an impact with their technology through data-enabled services. And now RepSignal is a SaaS platform. Dave, I would love for you to introduce yourself.
Great. Dave Roberts, retired. Senior Vice President and President of Medtronic, 39-year commercial experience at Medtronic.
So Dave, I'm going to start with the obvious question of how did we get you to wear a suit coat in retirement? Is this the first time since you retired?
Well, I don't put one on very often. I will have to say that. A good friend and a marketing guru, I'll say, Paul Verastro, challenged me. He said the only way that he'd come and watch and listen to this is if I put on one of my blue plaid sport coats. So Paul Verastro, this one's for you.
We know Paul well as well. And are you wearing jeans?
Maybe.
So how is retirement going?
I've got to tell you, it's absolutely fantastic. I had 3 goals when I retired 6 months ago. One was to spend more time with my family. I've got 4 small grandchildren and 1 on the way, and I'm doing a lot of that, having a lot of fun there. The other is golf. I said I was going to work on my golf game. Anybody that knows me knows that's not a short-term project, so I've got a lot of work to do there, but I am doing that. And then travel. I think I'm sure you have a lot of road warriors on this call today. I will tell you, it's much more fun to get on an airplane when you're doing it for fun than it is when you're doing it for work. Quite a grind, but really enjoying things. And really, it's given me a chance to reflect on, my career and what I've done over the last number of years.
So, and speaking of that, you just retired quite recently. Has it been a year yet?
No, 6 months.
Not 6 months. Yeah. So you had an incredible run, 39 years at Medtronic. How did you get into MedTech sales?
I'd like to tell you I really researched it, but it was pure luck. I grew up in Michigan, went to school in the state of Michigan, got out of school in the mid-'80s. Economic situation was not good. If you weren't working at General Motors or the town that I grew up in, Dow Chemical, really there wasn't a lot going on in Michigan. So I actually went to the newspapers. I found an ad and joined a small mom and pop medical sales company. We were selling TENS units and muscle stimulators. And just so you know, a TENS unit, you can now get them free with icy hot. So that's the kind of product I was selling. The first year that I was with them, Medtronic came in and bought us out. I'd like to tell you that I knew what Medtronic was at the time, but I did not. I tell people I went home and I jumped on the internet, and that isn't even true because the internet hadn't even been developed yet. I actually pulled the World Book Encyclopedia off the shelf, pulled it off, and found out that I was now working for a Fortune 500 company, really a Fortune 100 company in Medtronic. I think their sales at the time were somewhere between $600 and $700 million. So pure luck.
Amazing. Amazing. I remember those encyclopedias too. You're not alone. But you were more than just in MedTech. You ended up as a president of a division. I mean, that is a huge achievement. And we had a nice chat about how you achieved that success, but maybe you could tell this group a little about that.
Well, again, sometimes it's better to be lucky than good. I had the opportunity to grow and achieve some leadership positions in the small division I was in. Medtronic bought the TENS unit company because they were getting ready to get into implantable pain stim, and they wanted to understand, the electrode positioning and so forth. So I'm in an external division of Medtronic. I moved up very quickly in that division. I was a national sales manager at 29 years old, so really enjoyed the leadership part of it. Bill George at the time wanted to get out of external products, wanted to focus on implantables, and he sold the division I was in. So I had an opportunity to look at lots of different opportunities with Medtronic, but I decided at that time, pacing was the business at Medtronic. And some will argue it still is the business, but at that time it was, the largest percentage of the business. So I moved and I took a sales position to learn the business, very technical business. So I did that, and then I worked my way up, district manager role, RVP. The thing that I did, and I tell people this often, is you're building your career and you're looking at different opportunities, the key is to separate yourself from your competition. And when I'm talking about competition, I always looked at everybody else doing what I was doing as my competition. And so, I started to do things others weren't willing to do. Our family relocated 7 times. When I was a district manager in Indianapolis, I went back to Notre Dame and I went through their executive MBA program. I then, I was a regional vice president after that, and I went and I took a marketing job. And you don't get a lot of sales people, commercial people that want to go into marketing. Quickly found out I wasn't a marketer, so I moved back out into the field. But what that did teach me is I was able to learn what I'll call it the in-house group does and how hard they work to support the commercial organization. So you commercial people out there, if you think the in-house group isn't working for you, they're working extremely hard for you. And I think that really was key to some of my success. Is I was always willing to do a little bit more than some of the other people. I always thought of, when you're competing for a job, having great performance is table stakes. I mean, everybody you're competing with has been a successful sales rep or a successful DM. You have to do something that separates yourself, again, from your competition to move up in the organization. And then I did that. And the other thing I think I did pretty well is I adapted to change. And as we all know, over the last 30 some years, there's been a lot of change in this industry. And I'm sure people out there today, people on this call, are feeling a lot of change as well.
Exactly. And, in that long span of a career, people confronting the industry today may think, oh, we're undergoing a lot of change. But that change is a constant, as we discussed before the call. So maybe you could articulate some of the big changes you saw that were, sort of the sky is falling moment, and how you adapted. You had a couple examples of those.
Yeah, no, well, I want to kind of put it into a couple buckets. First, the environment. When you look back over 30 years, and let me start out by saying a commercial role in MedTech is the best job you can have. I mean, there are very few jobs that you get up every day and you go to work knowing that you're helping somebody out. But with that said, things change, and our reps need to adapt and stay relevant over the years, and this is nothing new. So let's look at what's happened over the last 30 years. Healthcare spending. It all starts with healthcare spending. Healthcare spending has taken off. I think back, I was looking at some data 30 years ago. Healthcare spending was in the 8 to 9% of GDP. Today, it's 17% of GDP. It's over $4.5 trillion being spent. So if you start there and you start working your way down, that's going to put pressure on our hospitals. That's going to put pressure on our physicians. That's going to put pressure on pricing. So, I mean, so what did we see? We saw consolidation of hospitals. We just saw a lot of change. We saw economic buyers taking more of a role in buying of product. You saw purchasing groups jump in. You just saw a lot of different change. So what did that mean to our MedTech companies? So MedTech companies, I mean, back 30 some years ago, they're all They're all growing double-digit growth, top and bottom line. They've got new products coming out. And when you looked at it, this expense of a MedTech company, two big buckets, still two big buckets, but two big buckets. One is R&D, the other is the commercial organization. So you put those two together, and that made up, I don't know, 80-some% of a company's expense, which is fine when there wasn't pressure on the company from an expense standpoint, which is fine when they were growing at 15 to 20% annually, no pressure there. It was fine when, local decisions were being made on product being used, all of that. The challenge is that all started to change because of the pressure on the healthcare systems and the pressure on overall cost. So that's change, and it's going to continue to change. And I think the one thing, if there's one message that people walk away from here is, the change has been here forever. That's just the market we're in. It will continue to change. And the most important thing our commercial organizations can do is prepare themselves for that change.
And you had talked about how you, as a sales leader, had prepared your team for that change. So you mentioned economic buyers and how important they are. In the past scenario, all that mattered really was your relationship with a certain group of providers that you knew were, your alliances that you could count on. And now all of a sudden you've got a team that's confronting these other stakeholders that they never had to really deal with before, these economic buyers. So you had quite specifically mentioned, ways you responded to get your team ready for that, emerging future, or what was already happening. So you want to talk about those?
Yeah. So, in the MedTech space, the best thing is when you can, have a technology where they absolutely need you in surgery. I'll give you an example. 6 months ago, I had the opportunity to work with a spine team in the Minneapolis area, and they're a robotic spine team. That team, I was amazed at what they do in surgery and the dependency that the physicians and staff have on this spine team. I mean, that's great, and technology will change, and there will always be that opportunity to be in a high-tech world and provide service inside the OR. But you've got to prepare for the other shoe to drop. And the other shoe to drop is the technology will change. They may not need you in surgery down the road. And if that's all you can do is go in there and, whether it's run the robot, or back when I was a rep, help with the defibrillators, when defibrillators first came out, when defibrillators first came out, there were 10 staff people in the room. The cases took 3 hours. It always seemed like a life or death situation. Today, a defibrillator is implanted in 20 minutes. You've got somebody from the company, and you might have 2 people from the hospital in there. That's the change that takes place. So you can't count on being that significant of a player in the OR. So a number of years ago, a couple things happened. The buyer was starting to change. It was moving from the physician to an economic buyer. So what we did is we took our top reps and our first line managers, and we put them through negotiation and C-suite training. We felt the need to give them skills that would allow them to have success in the future. AdvaMed. I think anybody that's been here for a few years remembers when AdvaMed hit and the Sunshine Act and all of that. Those were the days prior to AdvaMed. You spent a lot of time entertaining physicians, their spouses, their families, all of that. And when that shoe dropped, it was painful. I mean, I think most people thought their worlds were ending. But what reps, the really good reps that stayed relevant, they found other ways to work with their physicians. They found other ways to work with their customers. And because of that, they continue to have success.
One thing we didn't mention that really changed the game recently is COVID. You talked about OR access and access to providers and being integral into these procedures where all over the board technology is moving to eliminate that dependency a little bit. But COVID sort of accelerated some of this, didn't it?
Well, COVID accelerated a lot of things. I
Yeah.
think we saw a move to remote follow-up and remote technology being used in the OR versus having a rep there. Yeah, that was a significant change. The cost, the pressure it put on all the MedTech companies to either lower their cost or be more aware of their cost, that came because hospitals were spending millions and millions of dollars to get nurses in there. So those type, hopefully we'll never see another COVID again in our lifetime, but who would have expected that? Who would have thought that would have ever affected us, that, reps could barely go into the surgery anymore. And, if they did, they were in and out again. So yes, there's factors that come into play all the time, factors that you can't plan on or count on that are going to hit the organization. And I, again, that's one of the reasons I'm a big believer in continuing to expand your skill levels. Don't be that rep that throws scrubs on and only spends time in the OR. There may come a day where you're not needed in the OR and you better have other skills. I always used to tell people, reps, if you're only looking at a career of another 2 to 3 years, you may be able to do exactly what you're doing today and be safe. If you're looking out past 3 years, if you're looking out at 5 and 10 years, you better continue to adapt. You better continue to build new skills, and you better be ready for change.
So I think that's great wisdom for the individual contributor, the individual rep, and how they stay relevant, how they're successful in this new future. What about commercial organizations more broadly? What trends were you seeing in terms of adaptation of that structure, new roles that have emerged to deal with this changing world? What does that look like?
Well, I think, again, commercial organizations continue to change throughout time. What we're seeing right now, there will continue to be pressure on commercial organizations. Companies want to move money into R&D. The other thing, and maybe I mentioned this, but the economic support for to go along with the R&D. There's so many dollars that are needed in those areas, and one could argue that in some cases, you mentioned in COVID that reps couldn't go into surgery anymore. Physicians have less of a role in making a decision on the product. What is the long-term role of a sales rep? And I started out by saying I think it's the best job that somebody can have and a great career path, and I believe it. But I believe that commercial organizations must continue to adapt. Some of the things that I saw prior to leaving, remote or telesales. There are products out there now that don't need support, that I don't want to use the word commodity, but commodity type products that don't need a lot of support. You can cover a much larger area with remote sales for a lot lower cost. And to be honest with you, what we found is some of our hospitals got more attention by our remote sales force because they were out in the middle of nowhere and they rarely saw a sales rep. Sales reps were focused on the largest accounts, and now they've got somebody calling them and checking in on them, and they're loving it. The change in site of care, ASCs, physician-owned labs. This is a big deal, big deal. And that was an area that we were focused on prior to my retirement. We were starting to see some of our major businesses, some of the procedures move into the ASCs. And you can't necessarily cover ASCs because there's so many of them. In some cases, it's at a lower cost or a lower price point. You can't have the same type of people calling on the ASCs. You need a different type of model, whether that's remote sales, whether that's a lower priced clinical person, but you've got to look at different strategies for the change in site of care. We talked about remote capabilities. We'll continue to see more. I mean, there's companies every day that are looking at using remote follow-up. do you need a rep in the room? Do you need for just a standard case? Probably not. And you can do it through a remote where you've got somebody sitting in a room and taking multiple calls if the physicians need it. So there's a lot of different. The other one and a big one is a focus on corporate accounts, or and we call them enterprise accounts. And this is where you're calling on the large IDNs, the large systems, the GPOs, and you're doing the contracting out there. What we are seeing now is that the large systems, are driving, driving success in their mind by signing contracts. And, I worked for Medtronic. We had the broadest portfolio of any company, and we took advantage of that. We had the opportunity to, sign those type of contracts across the entire portfolio. But so the commercial organizations are changing. Everybody's looking for new ways to do things. There are only so many ways that you can sell a product, but there are less expensive ways, and companies are going to continue to look at it as they're stressed from an expense standpoint.
And those selling organizations, what we're seeing is, you've got reps carrying much bigger bags, having much bigger territories. Is that what you saw as well?
Yeah, I think you're going to continue to see that. I think you're going to see them carrying multiple bags of multiple products, covering larger territories. One is, in many cases, they can't get in. They aren't going into surgery anymore. So now they're selling the benefits of their product, which, you can do that more broadly. You can use less expensive people if there is case coverage necessary, you can use people to do that at a lower cost. Yes, and you're going to continue to see that. The day of just throwing money and people at a territory, those days are gone. This isn't, I don't mean to be negative. I don't mean to be a downer, because I will say it, and I'll say it often. This is still the best career path going, but as a sales rep, you need to adapt, and you need to look for ways to do things differently. I'll give you an example on that. Medtronic just had renal nerve denervation for hypertension approved. The physician doing the procedure there is not necessarily the physician that has all of the patients. So reps have now got to be able to bring these physicians together and help grow that business because of that. You can't just call on the procedural physician. You got to bring them together. And there are multiple products out there like that, and multiple technologies where the physician that is holding all the patients is not the same physician that will be doing the procedure. So what do you need for that? You need data. You need to be able to understand where those patients are sitting. You need to understand what physicians are seeing hypertension patients, what physicians are seeing this type of patient, and then find a way to steer those into the doc doing the procedure. Now, I say that, and that's a different skill set, a very different skill set than the person calling on a physician to sell the benefits of their product. You're now into more of a market development. You're looking for ways to bring physicians together, and that's going to take different skills. And that's how I would be training my sales force today, is on skills such as those.
I think that's a great segue to the future state of where are we headed with all of this. I think one reason why we connected with you was really thinking about that future state, and really that it's both a cultural change as well as a practical change in how you approach sales. So I guess I'll put the question this way. So when we approached you and said, hey, we'd love to get to know you, we'd love to work together, you did your diligence on us. You weren't ready to come out of your travel and golf and everything for nothing. So what did you see in what we were doing with Rep Signal that appealed to you?
Well, first, Amy, I'll say it started with you. You called me, I think, the first week I retired, and asked if I would be interested. And I think my feedback was, I haven't even had a time to play a round of golf. I'm not ready to do anything yet. I'm going to take 6 to 9 months and just relax a little bit. And then I think you called me at 6 months and 1 day to see if I'd put any more thought into it. So I think it starts there. I did do the due diligence. I called people. I looked online at at the company and what you're doing. And this is what I heard from people. I heard you've got a great team that personable, hardworking, ready to support all the needs. So that was number one. And I'm kind of a team guy. And when I heard that, I thought that was great. I heard that your data is fantastic. You're able to pull in data that some of these people were not able to get on their own. One example I heard is one sales VP said to me that they thought they had good ASC data, and you brought them data showing where physicians own part of these ASCs, and that was very new to them and something that was extremely helpful. So having the data. The other point is actionable data. And to me, so being a commercial guy all my life, trying to bring data into a commercial organization, trying to get them to use data. We all know back in the day, reps, and probably today still, they own their customers. They're going to wrap their arms around their customers. Nobody gets to see what my customers are doing or whatever. When you're trying to bring something to help out a sales force into the organization, whatever that tool is, I always viewed it this way. A third of the team, they adopt anything you bring in. They love it. They want to do it. They want to move forward with it. Another third will do it because they're forced to do it and their manager says they have to do it, and they will play a role. Then there's the other third that says, I'm not doing it. These are my customers. I don't need to. I'm in a good place. But what I heard on yours is that the data is useful, actionable, and there's actually a pull from the sales force. And that is key, is that there's a pull from the sales force. And you guys have that. So yes, I checked into you, and I think you've got something. Oh, the final thing is that somebody said was you're tied to Salesforce. You work with Salesforce, and that was key. Other companies state that they do a lot of work or they're integrated with Salesforce, and it's just not true. So I think all of those factors have really played a role. It played a role in my decision to work with you, but I think it's playing a role in the success that you're having.
What do you want to do next? You think you're going to still share your wisdom with the world?
Well, I've gone 28 minutes. It's probably all I have at this point in time of wisdom. So, I love the business. I love what we do here. I'll continue to do work like this. I stay well connected with my old Medtronic friends and offer support if I can to that group. But I am staying retired and looking forward to some more fun. So,
all right. Anything you follow in the news? Any other news you follow in MedTech, or are you really just reading novels at this point?
No, I'm not reading a lot of novels. I follow MedTech. I'm an investor in a lot of different MedTech companies, so I stay. My wife Susan would probably tell you I watch it a little too closely, even when I'm retired. So. I was there 39 years. It was my life. It was, it's all I knew for 39 years. And I was lucky enough to work for what I think was the #1 medical device company in the world. And very lucky in the way I got in there. And we'll do whatever I can to help them out as well.
Right. Katie is back. Questions? Yeah. Do we have questions?
Well, we've had some questions come in. And so again, appreciate the conversation and Dave for your time. If you guys don't mind sticking around, I'd love to ask a few of these to you, you and Amy, and you can let us know again if you got any answers here. So one came in, and it's very topical to what you had just said. So I'll ask that one first, but they said persistence and follow-up remain keys to success. Applying reliable and actionable data seems to be a big differentiator. But why is the integration with Salesforce platform a big plus?
Well, I'll give it to you from my perspective, and then Amy, you can take it. Most companies are doing work with Salesforce. I mean, Salesforce is your largest CRM company out there. They're building their platforms around Salesforce. I can't remember. We had so many different instances of Salesforce throughout the company at Medtronic, and we're trying to bring those together. But when most of the companies are doing work with Salesforce, and then you're tied to them as a smaller company, I think it can only be beneficial. Amy?
Yeah, and having worked with 170, 180 companies in the MedTech space over my years of consulting, we were able to do a little focus group when we decided to do Rep Signal and say, hey, we've got this great idea, AI-powered data, inside, a sales team, making it actionable. And we heard great feedback, and then it has to be in Salesforce, loud and clear. And I think that's to really align business goals across the board with the data. So if you want to deliver it, even though, so MedTech, I think, has about 80% penetration of Salesforce as their CRM. It's pretty high. They were early adopters of Salesforce. They're all a mess, I'll be honest. Like, they were so early that they all look like mini Frankensteins, but, and we take a sort of meet you where you are with your CRM approach. But, really in this future state that Dave described, you really need to bring the data all together in one spot with your business analytics, with your sales workflows. So, that's where we got to be.
I'm glad somebody picked up on that, persistence and follow-up using data is key, because I said it earlier, territory sizes are going to change. Your territories are not going to look the same as they do today, and you won't have the knowledge base that you have today in your current territory. You're going to have to learn more, and to have that data accessible and actionable is going to be absolutely key.
Oh, are you on mute, Katie?
Sorry, thank you. I have another, again, you'd think after COVID, we would have gotten this mute thing down. As hospitals recover financially from COVID, the appearance of value analysis committees and even moratoria for new products has been evident. How can product launches improve uptake with these barriers now so apparent?
Well, I'll say, and I kind of said this earlier, is that, you have to have the economic data when you bring out a new product. With the pressure on, most new products come out at a higher cost, right? Or a higher price point. That's MedTech. But you will have to prove that your product, again, will save the hospital system money and be beneficial for the patient. If you come in with a product that does not save the hospital money and is beneficial to the patient, and you can't prove it with economic data, you're going to have trouble getting it through the hospital system. So I think that's key. Again, data is key as you try to launch a new product.
And if I can just hop on that a little bit. So we have Rep Signal, we have data-enabled services. Our service business, which started in 2011, probably a good third of that is economic analysis, exactly toward what Dave was talking about, is how do we show a hospital in a VAC process or an IDN that a new technology is net beneficial, not just clinically, but economically. So now with the delivery vehicle Rep Signal, we can take that intelligence and actually embed it into the sales workflow. So, and we still do that level of analysis because it's so crucial. In fact, we've done it for your old company, Dave, a few times.
That's great.
Awesome. Another one. Any advice for for someone who is starting a new career in MedTech?
Have fun, number one. Learn from everybody that you can. It's intimidating when you start in MedTech. You're calling on physicians who are extremely knowledgeable. You're working through a system that's changing forever. So, just soak it in from everybody that you can and learn from everybody that you can. I had a number of young people that I used to meet with that, we just sit down over coffee and have those conversations. And, some of it is talking about what it used to be like and the change that's taken place, but some of it is preparing them for the future. And again, I can't stress enough, remain relevant in the business. Continue to learn, continue to reach out. That's how you're going to have success. There are a number of people that have had careers like mine that last for 30 some years in the med tech space. And the only way that you can do that is continuous learning and being able to adapt.
I guess I'll add one little quick thing is, and Dave maybe can relate to this, is 20, 30 years ago, the MedTech rep fit a mold, right? Former college athlete, very competitive, certain look. I think the nice thing about the changes in the field is there's room for more different approaches and skills to come into that equation, different backgrounds, different knowledge. So it's good to see that diversifying, and it needed to diversify. Would you agree, Dave?
Oh, absolutely. And it will continue to do that. I mean, if you look at the skills that are necessary, and we've talked about all of those going forward, you're going to need business people, you're going to need engineers, you're going to need a lot of different backgrounds to drive the success in the future. And negotiation, finance people. There are a lot of different roles and a lot of different backgrounds that will be needed going forward.
Wonderful. Okay, so we have someone who says, as an OR rep, what is one thing that you would focus on to differentiate yourself, not just amongst your internal peers, but also external competition?
Now, can you read that one more time, Katie? I'm sorry.
Yes, sorry. As an OR rep, what is one thing that you would focus on to differentiate yourself, not just among internal peers, but external competition as well?
I would, first of all, do a great job in what you're doing. Understand your product, sell your product, make sure you're working with your physicians and the OR staff. But I would start to make sure you understand what's important to your hospital. Why, what makes the CEO of the hospital stay awake at night? These type of questions. And you may not be able to make it all the way up to the CEO level, but you can start having conversations with the C-suite. You can have conversations with administration. I remember a story. We had a product that for heart failure, and the product was supposed to keep patients from having to return to the hospital with heart failure. I came in and I sold it to the hospital administrators as, we're going to keep your heart failure patients out of the hospital. And the administrator looked at me and said, why would we want to do that? We make money on our heart failure patients. And I immediately thought, I got to work on that presentation a little bit. And I think that's a skill. When you start calling on different type of people or having conversations outside of the OR, you got to make sure that you understand what's important to those customers. Here's the administrators at a hospital. They make their money on patients coming into the hospital. They don't want repeat patients within 30 days, but they want patients to come into the hospital. That's good for the patient. That's good for the hospital. It's good for everybody. So you want to make sure that, if you're spending all your time in the OR, start to understand what's important to those people that aren't doing cases every day or that are higher up in the hospital chain, because those are the people that are going to be making the decisions long term.
I'll add a little bit that there's always those other stakeholders around, the techs, the nurses, even the administrators. It's good to know all of them, at a very practical level, because they sometimes have more power than you think.
Yeah, great. Okay, what do you think the next big change in MedTech sales will be?
I don't think you're going to see something. I don't think you're going to see it change overnight. Again, when I look back over the 30 years, there are a number of times I said, oh my God, this is going to change. Reps aren't going to be allowed in surgery anymore. Well, that hasn't changed. COVID didn't change that. It moved back. What you'll find is there are going to be some products and some technologies that will always need the rep in the OR. There'll be some products and some technologies that don't need it. So I don't think it's going to change overnight. I think what you're going to continue to see is the economic buyer is going to be further and further away from our sales rep. And that's frustrating for a sales rep. Here I'm doing everything right. I'm building relationships. I've sold everybody on my product, yet a contract is, decided, 6 states away from me, and it's going to affect my business. Those are the types of changes that will continue to happen. I think you'll see more of, what I talked about is bringing different physician groups together. The physician that's holding the patients versus the physician doing the procedure. I think you're going to see more of that. And I think market development, because there's always new technologies coming out, and the days, and I say this broadly, not every company, but there were a number of times where we had market development teams and we had the implanting sales rep. I think cost is going to drive that into one type of sales rep that can do both things. And the other thing is, and we talked about it, the ASCs and the site of care. You're going to need. I think that's driving a lot of change right now, and I think the commercial teams have to be prepared for that.
I would just add AI, and I know you and I are neither the top experts on AI, although we have people in our team that are. But I do think a lot of basic tasks, even will be replaced by AI, and AI will be used to kind of quicken the pace of everything. So I know we're investing in a pipeline of AI solutions to embed in that sales workflow, and stay tuned on that, because I think that's going to be a big change for everyone.
Well, AI is absolute. I mean, you see it, and that's where, from a data standpoint, the commercial teams have to prepare for it. But I mean, the physicians are using AI. AI's in many of our products right now. I think of a product from Medtronic, GI Genius, when you're getting your colonoscopy, and GI Genius can find 14% more polyps. When I went for my last colonoscopy, not that anybody cares, but I found a physician that used GI Genius because I wanted to make sure that they had all the data and using every technology they could use. And you're going to see that more and more. And I think because of that, it's going to call on the commercial teams to understand it better. And everybody's got to get smarter. It's going to change the world a bit.
Amazing. I think we have a mixed bag of people on here. So there's a question. A lot of talk about sales. How does marketing fit into the commercial plan?
Well, I think marketing and sales, they're hand in glove. They always have been. When you talk about data, marketing, as they putting the strategy together in the plan, they need the data. They need to be working closely with the sales organization. I always looked at it as one large commercial organization, and marketing was my right arm. I mentioned Paul Verastro earlier today. He and I were lockstep when we were working together at Medtronic, and he didn't do anything. Well, he probably did a lot without me knowing about it, but I didn't do anything without him knowing about it, and just lockstep.
So when I was at Aspect Medical, more aligned maybe with marketing than sales a bit, marketing was described as sales overhead. Not a very and I think we've seen over the years that misalignment. Marketing's doing things over here, sales feels maybe a little bit disjointed from are they really helping me exceed my quota? One thing we're seeing is, the data is aligning of those two groups. If you're really having to think end to end of who am I targeting with what messaging, with what product, and how do I spend my time, it starts to really bring groups together in a way that I certainly didn't experience when I was inside a MedTech organization. So.
Yeah, and you can't, there are salespeople that are going to say marketing overhead or whatever is just sales overhead. But I go back to when I went in-house for a year and a half, and I saw the work that they do. And if you've got a good marketing team and they're working hand in glove with the sales organization, and they have the data and they're driving the same strategy, that's a recipe for success.
Absolutely.
Absolutely. Well, I know there's a few more questions. Let's see if we can. Oh, no, we just got a thank you. So perfect in the chat box. I think with that, we are at time. So Dave and Amy, thank you so much for this conversation today. Thank you to everyone that joined and for the questions that were sent through. We really appreciate everyone's time and hope everyone has a great rest of your afternoon.
If I could just close with one statement here, and I said it 3 or 4 times, if you're in the commercial organization and you're feeling change and it feels negative to you, it's just normal. I mean, it's what we've been doing and it's what we've been going through for 30 some years. So, continue to make yourself relevant, continue to learn, continue to adapt. You are in the best career you could possibly be in, and the career opportunities are endless.
Amazing way to end.
Everybody.
Well said. Thanks, Dave. Thanks, everyone.
Thank you, Dave.
Thank you.
Thank you.